Well, thank you so much for joining us today. My name is Ayla Brown. I'm a country music singer and an American Idol finalist, Season 5. And I'm so excited to present this year's ACVIM Animal Survivors. I'd like to give you a very, very warm welcome to Nashville, which is my home city. I've been here for 3 years and I absolutely love everything about it, especially the country music. The mission of the ACVIM is to enhance animal and human health by advancing veterinary internal medicine through training, education, and discovery. Today, we are here to honor amazing animal survivors who beat the odds because of these advances in veterinary internal medicine. The animal owner, general practitioner, and an ACVIM board-certified veterinary specialist work in partnership to help these animals overcome life-threatening illnesses to lead a healthy life once again. Each animal has a unique story of survival made possible by specialty veterinary medicine. The ACVIM looks for several unique stories each year that highlight this important work. I'd like to acknowledge and thank our sponsors, Blackwell King and Hills, who helped make this year's Animal Survivors series possible. So give them a round of applause, please. Now, without further ado, let's take a look at our amazing survivors.
I'm Brister Shum, and my dog is Spur. He's a beautiful 3-year-old golden retriever. He is our youngest son now. Spur's a very active golden retriever, as most golden retriever puppies are. And he's the kind of dog that would eat crayons, eat socks. On Christmas Day, he completely quit eating. So instead of having Christmas Day, we took him to the emergency vet clinic, and it was determined that he had blastomycosis. What this disease is a fungal infection where the dog sniffs a spore, a microscopic spore, and it turned into an infection in his lungs, in his skin, and in his eyes. And his diagnosis was guarded. He was a very, very sick dog. Dr. Kenny is our family vet, and initially Dr. Kenny just wasn't sure what it was, but he's known Spur since he was born, and he said this puppy's just not right. So Dr. Kenny's the one that referred me to the veterinary specialists who were able to do additional testing.
Well, we're just real fortunate here in this area to have a specialty hospital close. And we do refer a number of cases over there. In most cases, it gives a good outcome. I've never had a client not appreciate that.
Like most things, it's a team approach. Dr. Kenny recognized that it was a fairly significant eye problem. He and I have a great relationship. He sent Spur in, and once I saw Spur's problem, knowing Dr. Kenny as I did, I knew he would not care in the least if I got the very best possible care for Spur, and which is why I contacted Dr. Bayless.
His initial treatment started with antifungal medications to basically kill off those fungal organisms. His first several days in the hospital, he was very compromised. He had a really difficult time breathing. His color wasn't good. It was a little bit touch and go. I think he stayed with us for about 7 days in the hospital. And since then, he's been getting progressively better. And now he is a very normal dog. So if you saw Spur now, you would have no idea that he's ever been through anything like this or that he's sick at all.
Well, Dr. Bayless was actually one who was able to hold my hand all the way through it. So she was able to tell me, this is the prognosis, this is what we think is going to happen, and this is what we're going to do step by step for the next 4 to 6 months. So I felt like I was well informed the whole way and actually had an advocate. It was very nice having that relationship, actually a personal relationship with a specialist.
ACVIM is the College of Veterinary Internal Medicine, and so internal medicine specialists are doctors that have completed veterinary school and then gone on to do an internship usually, as well as a residency in internal medicine. And so we see actually a pretty good variety of cases, anything from infectious disease to endocrine disorders, respiratory diseases. So it's a pretty broad specialty, but it's all strictly internal medicine.
I feel like Spur got the best treatment that he would have gotten anywhere in the world. I just strongly recommend that if anything unusual happens to your pet, encourage your family vet to send you to a specialist and ask questions, do your research. Don't just hope that it gets better. Push just a little bit and develop that relationship with a specialist, because that's why we have a dog today.
Well, I'd like to introduce Dr. Danielle Bayless, who is an ACVIM board-certified specialist in small animal internal medicine and who helped give Spur the chance to lead a healthy life. Dr. Bayless, if you want to come up here just to be recognized right in front of the stage so we can give you a proper round of applause. Ladies and gentlemen, Dr. Bayless. Now let's take a look at our next celebrity animal survivor.
My name is Terry Wolf, and this is a barn cat that we adopted at 4 weeks of age, and her name is Tipper. I never used to be a cat person. I was always a dog person, but I have fallen for this cat. She sleeps with me at night. If I'm watching TV or watching a movie, she'll crawl up in my lap, and she loves to sit on my shoulder or whatever. She's become my world, I guess. We came in from watching a movie one night, and her eyes had pink stuff in it, so we thought she had the pink eye, so we took her to our local vet, and it kept getting worse, and then he referred us to Dr. Miller in Memphis.
Tipper's a young cat that presented to my practice, and at the time we diagnosed her as having an anterior uveitis, which is inflammation of the inside front vascular structures of the eye. This was an owner that wanted to do everything possible to get this cat back to normal. So I recommended that we get an internist. Knowing it's a systemic disease, who best than a specialist in internal medicine to do the diagnostic tests, to evaluate the cat, and then prescribe therapy.
Initially, the referral came to Dr. Miller in ophthalmology, but when he felt that it needed our input diagnostically to try and determine the underlying cause for the ocular disease, Dr. Miller made the referral.
Well, they diagnosed her with histoplasmosis, and that's a fungus. And they said that it comes from bird droppings or stuff like that.
The eye disease was so severe that she developed a severe ulcer in her cornea. And with that, Dr. Miller determined that the eye was not salvageable, and he removed it and sent it in for pathology evaluation, which confirmed that the eye was unfortunately riddled with fungal organisms as well. The second eye we removed several months later as follow-up lab tests revealed that the fungal infection was still persistent despite very aggressive treatment. We came to the consensus that the remaining eye had to be removed with hopes that if it was serving as a hiding place, if you will, for the fungal infection, get that eye out, perhaps she would respond to therapy, and thus far that has proven to be the case.
I think she has good quality of life. She loves to go outside, and we let her outside in our backyard. She loves to play with our basset hound and our other dogs. And we have some other cats, and they chase each other around in the yard, and she crawls all over the water fountains and the potted plants and stuff like that, and she crawls over everything.
Terry is, all of her animals are rescues. Tipper was rescued out of a situation where she was sharing a bathtub with a chickens in an outdoor environment. Not a great environment, likely where she contacted her infection. Despite all of the many challenges, financially, emotionally, we've never heard no once, and I don't think we ever will, because they are our true angels as animal rescuers and animal lovers.
I didn't know a specialist existed, and they're the ones that really saved her life. I'll never be able to thank them enough for saving Tipper.
I'd like to introduce some of Tipper's care team, Dr. John Sessions, ACVIM board certified specialist in small animal medicine, and his technicians, Jamie Miller and Brittany Story. If you want to just stand up and be recognized. And Lisa Price. Lisa, thank you for joining us today. Thank you. I'm so sorry I didn't have your name down here. Now for our final animal survivor who is actually here today, Tinkerbell.
I'm Cindy Plummer, and this is Tinkerbell Plummer, and we're in Sweetwater, Tennessee. She loves to play with Sammy and Peaches, and she likes her Cheerios. She kept doing all these little circling like she's doing in my lap right now. And I thought that was kind of cute, but it was a little odd too. And so I took her to Dr. Lively, and she sent me to Dr. Morgan, who was in their same office, and she's a ophthalmologist. And she said she's blind in the left eye, but it's not her eye. It's got to be neurological. So they sent me to Dr. Elizabeth Schull.
I've been taking care of Tinkerbell since she was a puppy, about 7 weeks of age, about 10 years ago. Those behavioral changes were the first things that we recognized. With Dr. Morgan, the ophthalmologist, and Dr. Schull, the neurologist, we've been, as a group, managing Tinkerbell's care for 10 years now.
Well, I've known Dr. Christy Lively for a long time. We have a really good relationship. She referred Tinkerbell to me. We proceeded to do a neurological examination, and we confirmed that she had blindness in her left eye and that she had weakness in the left side of her body, and everything pointed toward her having an abnormality in her brain.
And she was diagnosed with necrotizing leukoencephalitis, which they call NLE. Pretty rare, but it eats away the gray matter of her brain.
In her instance, there was so much loss of brain tissue that we thought the most reasonable expectation would be to stop further injury for as long as possible. So her treatment actually involves a combination of anti-inflammatory steroids and chemotherapy.
She's starting her 7th year of chemotherapy, and usually with NLE, they don't survive for 2 years after their diagnosis.
Surviving this length of time is pretty unusual. She has a great little spunky spirit. She's a real fighter. Her owner is exceptionally devoted and dedicated to her care. And working with Dr. Lively, the referring veterinarian, I think has all contributed to her surviving as long as she has.
I think she's got a very good quality of life. She joins in the play. She knows that everybody's here to love on her, and she's just really happy to be alive. That's why she just fights so hard.
Many of the same specialty areas that are available in human medicine are available in veterinary medicine. I think one of the advantages of having specialists in veterinary medicine is that it allows pet owners to have a range of choices in selecting care for their pets.
She would not be here if it weren't for these specialists that have been so wonderful in helping us to come up with a proper treatment plan for her.
Tinkerbell is a very amazing little dog. I am very humbled by this team. They really touch my heart.
We are so excited to have Tinkerbell joining us today, as well as her family members, Cindy and Audra Plummer, and her specialist, Dr. Elizabeth Schull, who is an ACVIM board-certified specialist in neurology, and Dr. Rhea Morgan, Tinkerbell's ophthalmologist. Please come on up so you can be recognized and so we can see the gorgeous little Tinkerbell. And if we could have all of our animal survivor specialists and families come on up for one more round of applause, please. Come on up, guys. Thank you guys so much. Now those are our amazing animal survivors for 2014. If you'd like to meet Tinkerbell or talk to any of our specialists, we invite you to come up after the program. And if you have a story to tell, be sure to visit the ACVIM website and submit it. Oh, thank you. Again, special thanks to our sponsors, Blackwell King and Hills, for their generous support of ACVIM's Animal Survivor Program. And on behalf of the ACVIM, I would like to thank everybody for their time and commitment in making these videos possible. We think these animals are wonderful, and we hope you do too. Thank you so much for coming.